Ever wonder how your childhood, shapes who you are today? We're going deep into attachment theory today, the science behind how those early bonds we form affect our emotional and mental well-being throughout life. We've got all these academic articles and book excerpts, and they all focus on this link between early attachment patterns and psychopathology.
Yeah, it's a super fascinating area. Basically, we're going to explore how those early bonds can set the stage for mental health challenges, later down the road.
So it's not like saying insecure attachment equals mental illness, right?
Right. It's not a direct one-to-one. It's more about like understanding how it can create vulnerabilities, especially when life gets tough and throws those curveballs.
Okay, so it's more like a foundation. It can be strong or, well, shaky.
Exactly. Think of it as a starting point. It influences how we react to stress and challenges, even just, everyday relationships.
Got it. So, in this deep dive, we'll be looking at how different parenting styles play a role and contribute to a child's attachment style. And we'll also be exploring the long-term effects, of secure and insecure attachment.
And we'll look at how those attachment issues might show up differently as kids grow,
Hmm.
like from childhood into adolescence, how things change.
And I think we're also going to unpack some of the newer therapeutic approaches, right? The ones that actually use attachment theory to help people.
Absolutely. It's all about recognizing patterns, building resilience, and just fostering healthy relationships overall.
Sounds good. I'm ready to unpack it all. Let's start with the pioneers, I guess you could call them, John Bowlby and Mary Ainsworth, Attachment Theory 101.
Yeah, for sure. Bowlby, he was a physician and a psychoanalyst. Actually, he focused on like extreme cases,
Hmm.
kids who had experienced some serious adversity like trauma.
So, think about children who've been through really tough stuff, like abuse or neglect.
Exactly. His work with those children really highlighted how crucial that sense of safety and security is, especially in those early years.
So he was looking at those intense situations and how they could really have a lasting impact on these kids.
Yeah, his work with these kids was the foundation of his theories. He was emphasizing the link between these early experiences and insecure attachment and, well, psychopathology.
Makes sense. So then where does Mary Ainsworth fit in?
So Ainsworth was a developmental psychologist, and she took a bit of a different approach. She was really interested in understanding attachment in like everyday families,
Mhm.
not just those extreme cases.
So it wasn't just about focusing on the extreme cases, but looking at what was happening in, I guess, more typical families.
Right. So she actually observed parents interacting with their children in their homes. And she also developed what's called the strange
A
situation.
strange situation.
Yeah, it's a lab setting. It let her observe these parent-child interactions in a more controlled way.
Oh, interesting. Okay. So she was looking at the whole spectrum of attachment from secure to insecure in those, more typical families.
Exactly. And through her research, she identified three main attachment patterns.
Hmm.
You've got secure, insecure avoidant, and insecure resistant.
Okay, let's break those down a bit. I'm guessing secure attachment is the ideal, right? What we're all aiming for.
You got it. In secure attachment, the child really trusts that their caregiver is there for them, available and responsive to their needs. They feel safe to explore the world, knowing they have that secure base to return to when they need comfort or support.
It's like having that solid foundation, like a safety net that lets them go out and explore with confidence.
Now, on the other side, we have insecure avoidant attachment. You can imagine a child who seems perfectly independent. They rarely seek comfort from their parents. So you might think, oh, they're just, naturally self-sufficient.
Hmm.
But what's interesting is that this avoidant behavior can actually be a sign that they've learned to suppress their needs because those needs weren't consistently met by their caregiver. It's almost like they've adapted to this environment where expressing their needs, well, it just doesn't get them what they want. So they've learned to shut down those needs instead.
That's a good point. It's like a reminder that sometimes what we see on the surface might be masking something, something deeper.
Absolutely. And then there's insecure resistant attachment. So here the child is, clingy and anxious, and that's because their caregiver has been inconsistently available. Sometimes their needs are met, sometimes they're not. So they're constantly kind of on edge, unsure what to expect. And this inconsistency can really impact their ability to regulate their emotions later on. It can affect how they form healthy relationships as they get older, too.
It's like they're always on high alert, never quite sure if their caregiver will be there for them or not.
You're spot on. It all comes back to that uncertainty and inconsistency in those early caregiving experiences. Now, there's another attachment pattern that we should talk about, and it's a bit concerning. Disorganized attachment. This pattern often shows up in children who have experienced what's called frightened or frightening caregiver behavior.
Okay, that sounds pretty intense. What is that? Like, what does that actually mean?
It means that the caregiver, they might actually be a source of fear or distress for the child, either through their own actions, or even just their inability to regulate their own emotions. And for the child, this creates a really difficult situation
Yeah.
because they are like biologically wired to seek safety and comfort from their caregiver. But that same caregiver is also, well, a source of fear. It's a real paradox.
So they're like stuck wanting to be close to the caregiver, but also being afraid of them at the same time. That's got to be
Yeah.
hard.
It is. And sadly, this disorganized attachment, it's been linked to, well, a higher risk of various mental health issues later in life. So it really emphasizes how crucial those early caregiving experiences are for development.
All this talk about different attachment styles, and it makes me wonder if we're like stuck with the attachment style we develop as kids. I mean, does it just stay with us forever?
That's a great question. And the good news is attachment patterns aren't, set in stone. While our early experiences definitely lay the foundation, our experiences throughout childhood and adolescence, even adulthood, can influence how these patterns, how they evolve.
So there's hope.
There's always hope. Think of it as a path you're on. You might start out on a certain path, but you can always choose to change direction. It's never too late.
So like a child with a secure attachment history might face challenges later on, but generally they're more resilient, right?
Yeah.
Better able to cope.
Exactly. And then on the flip side, a child with an insecure attachment might be more vulnerable, but positive experiences and support, these can help them develop healthier ways of coping and relating to others.
That's good to hear. But what about trauma? What role does that play? Because I've heard that trauma, especially when combined with disorganized attachment, can really increase the risk of developing some more serious mental health challenges.
Absolutely. This is really important to understand. Trauma plus disorganized attachment, it can create a vulnerability to what we call dissociation.
Okay.
Dissociation, think of it like a coping mechanism. The person detaches from reality mentally, almost like their mind is trying to protect them from overwhelming experiences,
Yeah.
like by disconnecting from them.
So it's almost like their mind is trying to like shield them
Yeah,
from
right.
too much pain.
Yeah, you can think of it that way. And research actually shows that this early tendency to dissociate, coupled with later trauma, it can contribute to a whole range of mental health issues. It's a pretty complex picture, though, because you've got those early attachment patterns influencing development. And then, on top of that, you've got experiences of trauma that can complicate things even further.
It's like layers, right? It's not just one factor. It's this combination of things that can impact our mental well-being. It's a lot to think about.
It is. It's intricate, for sure. But understanding these layers is super helpful in addressing mental health challenges because it lets us see the roots of certain patterns, and then we can develop more targeted and effective ways to actually help.
So we've talked about attachment patterns and the impact of trauma, but how does this understanding actually, change the way therapists work with people? How is attachment theory used in therapy?
Well, honestly, attachment theory has been like a revolution for psychotherapy in so many ways. It's like, giving therapists this new lens to look through. Instead of just focusing on symptoms, therapists can see those symptoms as clues, clues to the underlying relational dynamics, the things that might be contributing to the person's struggles.
So it's not just about asking, what's wrong with you,
Yeah.
but more like, what happened to you and how did those early experiences shape the way you see the world and yourself?
Yes, exactly. It's about understanding that those early attachment experiences, they shape so much of who we are. Our expectations of relationships, how we regulate our emotions, even our sense of self-worth.
I'm curious, how do therapists use this information, practically to help their patients?
A key part of it is helping patients understand their internal working models and, well, reevaluate them. You can think of these working models as blueprints for relationships that we develop in early childhood based on those interactions with our caregivers,
Yeah.
and they continue to influence how we see things, our perceptions and behaviors in relationships throughout life.
So, like, let's say someone had a caregiver who was constantly unavailable or, I don't know, rejecting. That might lead them to develop an internal working model that says, I'm not worthy of love or people can't be relied on.
Exactly. And those beliefs, even if they're unconscious, can really affect their ability to form secure and fulfilling relationships. So a big part of therapy is helping people become aware of these unconscious patterns and how they might be, playing out in their lives. It's like bringing those beliefs to the surface,
Yeah.
into the light, so they can be examined and challenged.
It's like saying, hey, look at this belief you've been carrying around. Is it really true? Is it accurate? Or is it just, based on past experiences?
That's a great way to put it. And once those beliefs are, brought out into the open, that's when the healing can really begin.
This is all so insightful. I can already see how understanding this stuff could be helpful, and not just for therapists, but for, really anyone who wants to have healthier, more fulfilling relationships.
Absolutely. It's about understanding those underlying patterns and learning to create more secure connections with ourselves and with others. It's a journey, but it can be so rewarding.
Before I move on, I want to circle back to something you mentioned earlier, the interplay of different behavioral systems. Can you explain that a bit more? It sounded interesting, but also a bit complex.
It is complex, but it's fascinating too. Essentially, it's the idea that we all have these different needs and motivations, systems for caregiving, exploration, dominance, and more. And all these systems are constantly interacting, influencing each other. And the way these systems interact can actually impact our vulnerability to psychopathology.
Okay, so it's not just about attachment, but how attachment fits into this larger, I guess, system of needs and motivations.
Exactly. Think of it like this. Imagine someone with a very rigid hierarchy of these systems. Let's say their primary coping mechanism is to always seek reassurance from others.
Okay.
So then what happens if they're in a situation where that reassurance just isn't available? What then?
Yeah, what happens then?
Or what if their attempts to get that reassurance are met with rejection? Their primary coping mechanism fails, and they don't have a plan B. And that's when you might see those more maladaptive coping mechanisms emerge, like withdrawal, aggression, or even dissociation.
So they're kind of stuck because their go-to solution isn't working, and they don't have any other tools.
You got it. And this just highlights why it's so important to develop a more flexible, a more adaptive repertoire of responses. It's about having more options, more tools to use, so we're not so reliant on just one way of coping.
I'm really curious to hear more about how therapy can help people develop that flexibility.
Well, that's what we'll be diving into in the next part of our deep dive. We'll be exploring some of the specific techniques that therapists use to help people become more aware of those internal working models, challenge those limiting beliefs, and develop healthier ways of coping and relating to others, too.
Sounds good. I can't wait. This is all so fascinating.
It is. And it's really all about understanding ourselves better so we can create more loving and fulfilling relationships with ourselves and others.
Welcome back to our deep dive into attachment theory and psychopathology. Before we started talking about all this, I never really thought about how much my early experiences could, be affecting my relationships today. But now I'm, seeing those patterns everywhere.
It's pretty amazing how eye-opening this stuff can be, right?
Yeah.
It's like suddenly you have this new lens to view your life through, and you start noticing things you never even, realized were there before.
Exactly. And in the last part, we were talking about how some people, they can get stuck in those rigid patterns where they only have one way of coping. It made me wonder how therapy actually helps people become more, flexible and adaptable in their responses, especially when those old patterns feel so ingrained.
Well, one of the most, I think, powerful approaches is to help people identify and challenge those core beliefs about relationships, those, deep-seated ideas that are often formed in childhood, the ones that can really hold us back.
So if someone's internal working model is telling them, I'm not worthy of love or people will always let me down, therapy helps them, question whether those beliefs are actually true.
It's like putting those beliefs on trial. We look at the evidence, both from their past experiences and their present relationships, and we just see if those beliefs hold up, under scrutiny.
So it's not about erasing the past, but about using that understanding to create a new story, a more positive and hopeful future. Have you seen that happen with your patients, where they start to shift those old beliefs?
Oh, I see it all the time. And it's honestly one of the most rewarding parts of my job. As people start to question those limiting beliefs, they can begin to create new narratives about themselves and their relationships, more empowering ones. It's like they're finally breaking free from those old chains that have been holding them back.
That's really inspiring. I imagine it can be a challenging process, though, to let go of those familiar, even if they're painful, patterns.
It definitely takes courage and commitment. But one of the most amazing tools we have in therapy is well, the therapeutic relationship itself, it can be incredibly healing, especially when it's, grounded in an understanding of attachment.
I've heard people talk about the power of the therapeutic relationship, but I've never fully understood it. What makes it so special?
Well, think about it this way. For a lot of people who struggle with insecure attachment, that therapeutic relationship, it can offer a corrective emotional experience. It's a chance for them to experience what it's like to have their needs met consistently, to feel seen and heard, and to, develop trust in a safe and supportive environment.
So the therapist becomes like a sort of secure base for the patient.
Exactly. It's a chance for them to, really explore their emotions, their vulnerabilities, their relationship patterns without fear of judgment or rejection. And as that trust builds, they may start to feel more secure and confident in their other relationships as well, like a ripple effect, spreading outward into other areas of their lives.
Makes sense that feeling safe and understood in therapy could then give people the courage to be more vulnerable and open in their other relationships too.
That's the hope. It's like they're practicing those new skills, being vulnerable, expressing their needs, setting boundaries, but they're doing it in a safe space. And then they can take those skills and use them in the real world.
Now, we've been focusing on individual therapy, but I know attachment theory is also super relevant for couples and family therapy. How does it apply in those settings?
Well, when we look at relationships through an attachment lens, we start to see those, relationship patterns, the conflicts, the misunderstandings, the disconnections as expressions of those deeper attachment needs, the need for connection, for reassurance, for, security.
So instead of blaming each other for their problems, couples can begin to see those struggles as, stemming from these often unconscious patterns, these yearnings that are rooted in their attachment styles.
Exactly. And it can be really helpful for couples to understand their own attachment styles. It's like having a map of each other's emotional landscape. It can help them understand why they react the way they do in certain situations. And it can also provide a roadmap for how to communicate and connect more effectively.
I can imagine it can be really, I don't know, illuminating for couples to realize that their differences aren't personal attacks, but rather expressions of those deeper needs.
It can be a real game changer. Imagine a couple where one partner has an anxious attachment style and the other has, an avoidance style.
Mm.
Without this understanding, they might keep getting caught in those classic patterns. One pursuing closeness while the other pulls away.
And neither of them really understands what's going on.
Exactly. But once they understand their attachment styles, they can start to make sense of those dynamics. They can see that the anxious partner isn't, being needy. They're just expressing their need for connection, in the only way they know how. And they can see that the avoidant partner isn't being cold. They're just trying to protect themselves from getting hurt.
That takes the blame out of the equation and creates, space for empathy and understanding.
Right. And from that place of understanding, they can start to create strategies for meeting each other's needs in a way that feels safe and secure for both of them.
That's really beautiful. It makes so much sense. One of the things that's been really impactful for me is learning about the effects of trauma, especially when it's combined with disorganized attachment. It's heartbreaking to think about all those people carrying the weight of those early experiences, especially if they didn't have, a secure base to help them cope.
It's such a crucial area, and unfortunately it's been, overlooked or misunderstood for far too long. The research is very clear. Trauma, especially when it's experienced in childhood, can have a huge impact on, everything.
Mm.
Brain development, emotional regulation, interpersonal relationships.
It makes me think about the difference between someone who experiences trauma but has a secure base to turn to versus someone who doesn't have that support. It seems like that would make a really big difference in how they process and, heal from that experience.
Absolutely. If a child experiences trauma and they have a caregiver who can offer comfort and support, a sense of safety, that trauma is less likely to become, embedded in their nervous system. They have a safe haven, to process those difficult emotions.
But if that safe haven isn't there,
Then those traumatic experiences can become like a lens, a lens through which they see the world. And the world might feel unsafe, unpredictable, even dangerous. And that perception can lead to, a whole range of coping mechanisms, some of which, might be helpful in the short term, but can create problems down the road.
so those coping mechanisms we talked about earlier, withdrawal, aggression, dissociation, those are often ways of managing the overwhelming emotions and anxieties that come from unresolved trauma.
Exactly. And while those coping mechanisms, I mean, they're understandable given what these people have been through, but they can create so much difficulty in their relationships, work, overall well-being.
It makes me think about those people who, like, seem to be constantly reacting from a place of fear or anger. Maybe they're not just being difficult. Maybe they're just carrying a lot of, well, unhealed pain.
You're so right. It's important to remember that everyone is, fighting a battle we know nothing about. And sometimes those behaviors that we find challenging, they're actually cries for help, expressions of that underlying hurt.
Makes me wonder how we as a society can do a better job of supporting those who have experienced trauma, especially those who didn't have that, that secure base early on.
That's the million-dollar question, isn't it? We need more trauma-informed care, like in all areas of our society. Schools, healthcare, the justice system. We need to, recognize how common trauma is and create more supportive and compassionate environments for healing.
And we need to understand that healing from trauma is, well, it's a journey, not a quick fix.
Absolutely. It takes time, patience, and the right support. But there are some really incredible trauma-informed therapies out there. EMDR, for example, has become pretty well known.
I've heard of EMDR, eye movement desensitization and reprocessing, right?
Yeah, that's it.
It sounds like it helps the brain, like, reorganize those traumatic memories
Yes.
in a way that, makes them less distressing.
That's the basic idea, yeah. Another one is TFCBT, trauma-focused cognitive behavioral therapy. This one helps people identify and challenge those, negative thoughts and beliefs that have come up as a result of the trauma.
So it's about, like, reframing those thoughts and creating a more, I guess, balanced and realistic perspective on what happened.
Exactly. Both EMDR and TFCBT have been shown to be really effective in treating PTSD and other trauma-related disorders. And of course, the role of attachment is, well, essential in trauma recovery as well.
That makes sense. You were saying earlier that the therapeutic relationship, it can be like a healing experience in itself. I imagine that's even more important for someone who's working through trauma, especially if they have, a history of disorganized attachment.
You're absolutely right. For those individuals, creating that sense of safety and trust in the therapeutic relationship, it's paramount. It's about creating that secure base, that haven of support. It allows them to, well, face those painful memories and emotions without feeling overwhelmed or, re-traumatized.
It sounds like the therapist's ability to provide that safe haven, that secure base, it can really, make or break the effectiveness of trauma treatment.
You got it. It's delicate, a complex process, and it requires, a high level of skill and sensitivity, attunement from the therapist. It's not about rushing the process or forcing someone to face their demons before they're ready. It's about, meeting them where they are, gently guiding them towards healing at a pace that feels safe.
This deep dive has been so insightful, highlighting just how connected attachment, trauma, and mental health really are.
It's a fascinating web, isn't it? And we've covered a lot of ground. But before we, wrap up completely, I want to make sure we talk about the power of self-regulation. Remember those complex behavioral systems we were discussing? Well, self-regulation is the key to, navigating those systems effectively.
Okay, remind me, what's self-regulation again?
It's our ability to, manage our emotions, thoughts, and behaviors,
Yeah.
especially when things get tough. Think of those people who, they stay calm under pressure. They can think clearly, even when they're feeling stressed or overwhelmed. They've got strong self-regulation skills.
So someone with good self-regulation skills, they might be better equipped to handle, I don't know, conflict, disappointment, or even rejection without completely, like, falling apart.
Exactly. They can stay grounded even when life, throws curveballs their way.
But what about those of us who, struggle with self-regulation? Can those skills be, like, learned?
That's the good news. Self-regulation is a skill, and it can be cultivated, through practice and support. It's not about being born with a certain temperament. It's about developing those tools and strategies to, well, to manage our inner world more effectively.
Okay, that gives me some hope. So it's not about being perfect, but about learning how to, navigate those difficult emotions in a healthier way. What are some of the techniques that can help people strengthen those self-regulation muscles?
Well, that's a perfect segue into the final part of our deep dive. We're going to explore some specific tools and techniques that can help you cultivate greater self-awareness and, well, emotional mastery.
Welcome back to, well, the final part of our deep dive into attachment theory. I feel like we've uncovered so much already, but I'm really intrigued by this self-regulation idea. We touched on it at the end of the last part. It just seems so crucial, for relationships.
It is, really. Think of self-regulation as like your inner compass. Helps you stay on course, even when, things get tough. It's about having those internal tools and strategies, the
Yeah.
ones that let us manage our emotions, thoughts, behaviors, especially, when we're faced with challenges or triggers.
Okay, so it's like having that inner strength and stability. It helps us get through those tough times, without completely losing it. I get how that would be important for relationships, but also just for, life in general.
Absolutely.
Huh.
And the good news is that, well, even if you haven't always had the best self-regulation skills, it's something you can definitely learn. You can improve over time.
Yeah,
It's like, building a muscle. The more you use it, the stronger it gets.
that's good to hear. So what are some of those techniques? The ones that help us, strengthen those self-regulation muscles?
Well, one of the most, I think, powerful techniques, and one that's been researched a lot, is mindfulness. Have you ever tried mindfulness practices?
I've tried meditation a little bit, but I'll admit I haven't been very consistent. Is that what you mean by mindfulness?
Yeah, meditation is one form of mindfulness for sure, but it's really about bringing a certain quality of attention to, well, to anything you're doing,
Mm.
whether you're meditating, walking, eating, even just having a conversation. It's about, paying attention to the present moment without judgment, noticing your thoughts and feelings, but not getting swept away by them.
So it's like creating a space between those thoughts and feelings and, well, your reaction to them.
Exactly. And that space, it's crucial because it gives you the power to choose how you want to respond instead of, just reacting on impulse based on those old patterns. It's like hitting the pause button before you, say or do something you might regret.
That makes sense. So instead of just like letting my emotions run the show, I can be more aware of them and then, well, actually choose how I want to, handle them.
Exactly. And the more you practice mindfulness, the better you get at recognizing those emotional triggers. And then you can choose, a more skillful response.
You mentioned meditation is one way to practice mindfulness. Are there other ways to like incorporate it into everyday life?
Oh, tons of ways. Mindful walking is a great one. So instead of just, rushing from point A to point B, you just slow down. You pay attention to the sensations of, your feet on the ground. Notice the sights, the sounds around you. You just bring that present moment awareness to the experience.
So it's like, turning a regular walk into like a mini meditation.
Exactly. And you can do the same thing with eating. Instead of just mindlessly, shoveling food into your mouth, you slow down. You savor each bite.
Hmm.
Pay attention to the flavors, the textures. You really appreciate, the nourishment.
I like that. It's about, bringing more awareness to those everyday things, the stuff we usually do without even thinking.
Right. And the more you practice this, the more you'll start to notice those automatic reactions, and those habitual patterns that might not be serving you anymore. And then from there, you can start to make different choices.
It's like mindfulness gives you the ability to like step outside of those automatic patterns. You can kind of become the author of your own experience, right?
Yeah.
Instead of just, reacting to life on autopilot.
Couldn't have said it better myself.
Mm-hmm.
Now, another really valuable technique for self-regulation is cognitive reappraisal.
Okay, remind me. What was cognitive reappraisal again?
So it's basically about changing how you think about a situation. We all have those, those automatic negative thoughts. They just pop up, especially when we're stressed or triggered. Cognitive reappraisal is about, well, identifying those thoughts and then challenging them. Like, are they even true? It's like taking those thoughts to court and presenting a counter argument.
So instead of just, accepting those negative thoughts, I can actually question them and look for a more balanced perspective.
Yes. Let's say, for example, someone cuts you off in traffic. Your first thought might be, that jerk. They did that on purpose. They have zero respect for anyone.
Oh, yeah, I've totally been there. Definitely had those road rage moments.
Right. But with cognitive reappraisal, you might pause and think about other explanations. Maybe they didn't see you. Maybe they're rushing to the hospital. Maybe they're just having a really, really bad day.
So it's not about, pretending I'm not angry or frustrated, but about choosing a more balanced way to see the situation.
Exactly. And that shift in perspective can make a huge difference in how you feel, how you react.
It's like, I don't know, it's like taking the power away from those negative thoughts and choosing a more empowering way to respond.
I love that. And the great thing about both mindfulness and cognitive reappraisal, they're skills you can practice anytime, anywhere.
So helpful. It's amazing to think we can actually, train our brains to be more resilient, more emotionally balanced. But I'm also thinking about how this all relates to attachment. We talked a lot about how our early attachment experiences can create, these patterns that show up in our adult relationships. So where does self-regulation fit in?
That's a great question. When we have good self-regulation skills, we're less likely to, well, to project our insecurities or those unresolved issues, onto our partners. We're less likely to get triggered by their behaviors, and we're better able to just communicate our needs in a clear way.
It's like we're taking responsibility for our own, emotional well-being instead of expecting our partner to like fix us or make us feel secure.
Exactly, and that's a huge step in creating a more secure relationship, a more fulfilling one too. When you can regulate your own emotions, you're able to show up for your partner in a way that's supportive, understanding, emotionally available.
So it's not about being perfect or never having, any difficult emotions, but it's about having the tools to deal with those emotions in a healthy way, right? Without letting them like take over the relationship.
You're getting it.
Mm.
And what's really cool is that research suggests, by developing our own self-regulation skills, we can actually create a more secure environment for our kids,
Yeah.
a more nurturing environment, which can help break those cycles of, insecure attachment that sometimes get passed down through families.
That's hopeful. It means that by healing ourselves, we can heal those generational wounds and create a better, more positive legacy for our families.
Exactly. It's about the power of this stuff.
Yeah.
Understanding attachment theory and actually working with it. It's not just about, mental health challenges. It's about deeper connections, greater resilience, and ultimately more fulfilling lives.
I feel like this deep dive has been such a journey. I've learned so much, and I'm definitely, inspired to keep learning about this stuff. Attachment and healing, it's fascinating.
I'm so glad to hear that. It's been a pleasure, diving deep with you. And remember, this is just the start. The more you understand about attachment and the more you, practice those self-regulation skills, the more you can create the relationships you want, the kind of relationships you deserve.
Well, thank you for joining us for this deep dive into attachment theory. We hope you've learned some, valuable insights, found some helpful tools to help you on your own journey, your journey of growth and connection. Until next time, keep exploring, keep learning, and keep diving deep.